Patients present to me with, a spectrum of symptoms. Some are very early in their arthritic process. They have early pain with activities or with certain activities or with sports, whereas I would see someone who is bedridden because they have severe arthritis and didn't realize that it was a problem with their joint. Most common symptoms are pain in the joint, stiffness, and inability to carry on day-to-day activities. At the Hospital of St. John's in Elizabeth, if you have a hip or a knee problem, you'd be seeing a specialist who deals with these kind of problems. From booking in to see one of the subspecialists, you would be seen in clinic. You would have x-rays and sometimes other imaging in the form of MRI scans. You would then get an advice based on your particular situation as to what is best for you. If you choose to have surgery, then you go through a process of pre-assessment where we make sure your heart, lungs, and your organ systems are ready to have that anesthetic and ready to go through that surgical procedure. Hip replacement is a surgical procedure where, as an orthopedic surgeon, I would replace the ball and socket joint of your hip with an artificial one. You have anesthetic, which could be a spinal anesthetic or a general anesthetic. While you're under the influence of the anesthesia, we make a small cut in the top part of your leg. We take out the ball of the ball and socket joint. We take away a few millimeters of cartilage and bone from the socket side, and then we put a titanium implant, a long pin that goes into your thigh bone, a titanium shell that goes into the socket, and put a new bearing. So today's implants are made of titanium. They directly bond on to your bone. They're press fit. There's nothing between the implant and your bone. The moving bits are made of ceramic ball, which in simple terms is a polymer which is cross-linked so much that it gives you a low friction arthroplasty. It is this that allows those joint replacements to go on for 30 years in a successful joint. Most patients after hip or knee replacement are ready to go home in 1 or 2 nights, being able to do all day-to-day activities. So most patients, I notice, have some amount of outpatient physiotherapy, again working on strengthening your muscles, getting your gait corrected, making sure your other joints are doing well. And that process takes anywhere up to 6 weeks. After hip replacement, most people get into a stage called a forgotten joint, where they forget that they had a joint problem and they're back leading their life like they were in their 20s. It is extremely important to listen to your patients, because not everyone comes to me asking or seeking surgery. Sometimes patients just need reassurance. So listening to them gives you that additional benefit of being able to then direct their life, their treatments in the way they would like it. So St. John's and St. Elizabeth's is a great hospital. I recommend it to anyone who's considering having a joint replacement surgery. You have state-of-the-art facilities, you have a great ward, you have amazing physiotherapy. You'll be very well looked after. I do a high volume of hip and knee replacements and almost do 2 or 3 times the national average of joint replacements right now. I choose to work at Hospital of St. John's and Elizabeth's because there's a great team supporting me. So starting from your outpatient care to your physiotherapy care, pre-assessment, and theatre staff, I think it's extremely important I have the right backing and the right support so I can give you a great outcome. I find that most people are nervous around elective procedures because it is a choice one makes. So the message to those patients is, 1, trust your surgeon. 2, trust your own instincts. If you think you're really worse off at this point of time, you have a poor quality of life, your pain is really hampering your life and your day-to-day activities, then the surgical outcomes nowadays are extremely good. Anesthesia is safe, techniques are good, implants are great, and you should not be nervous. This will really give you a good quality of life. It'll change your life forever.